I'd like to wish everybody a happy new year. It's hard to believe we're this far into January already. And it's wonderful to see everybody get the holidays behind us. And as we step into 2026, I'm very excited about all the things we're going to do this year. What we do matters deeply in communities across Ohio. And I'm grateful, I know, to be working with each and every one of you to have a meaningful and impactful 2026. Before we dive into our agenda today, I'd like to introduce Sarah, and I'm going to try to get this right. Damani. She actually told me 10 minutes ago. That's what is it? I got a goldfish memory, I guess. And she's working with One Ohio as a contractor to support the board at meetings this year. I've been to have a housekeeping as we get started. For those of you who are in person today, your packet should include contact information, committee assignments, and for those who still need to draft photos for your review, and the photos of yourself, by the way, not family vacations, I might say. So please take a look at these documents and confirm everything's up to date and correct, and give your packet to Sarah before today's meeting. For those attending virtually, this information will be sent to you in an email following the board meeting. Now, that being said, I want to turn over to Sarah to lead us through roll call so we can establish that we have a quorum available for today's meeting.
All right. Director Baker. Director Kleemeyer.
Here.
Director Terry Johnson. Director Rob Blaisdell.
Here.
Director Tyler Lee. Director Driehaus. Director Matea. Director Stylak. Director Greta Johnson.
Here.
Director Hohadel.
Here.
Director Piccirilli.
Here.
Director Dodge.
Here.
Director Powell. Director Worsbicky.
Here.
Director Mason.
Here.
Director St. John.
Here.
Director Greta Mayer.
Here.
Director Amen.
Here.
Director Bruce.
Here.
Director Hondrew. Director Whitson.
Here.
Director Ayers.
Here.
Director Gregoire.
Here.
Director Kidd.
Here.
Director Lee. Director White.
Here.
Director Radcliffe.
Here.
Director Roizen.
Rachel Baker is on as well. We had all you.
Hi, this is Rachel Baker. I'm here.
Got it. We have.
Good morning. Dawn Tyler Lee is here.
All right, very good. We have a quorum. The next item then on the agenda is the agenda approval. Are there any proposed edits to the agenda? Then hearing none, is there a motion and a second? Larry makes the motion, Evan seconds the motion. All in favor of adopting the agenda, say aye. Opposed, and the motion carries. The next item in your packet is the minutes of the prior November meeting. Can I have a motion and a second to approve the minutes of the November meeting? Jeanette makes the motion. Jim White seconds the motion. Any discussion on the minutes? All in favor say aye.
Aye.
Opposed, and motion carries. Now we're moving on to a presentation from the Ohio Department of Health, and I would like to turn over to Alicia. Introduce our speakers.
Well, good morning, everyone. And thank you in advance for your patience with my voice. I am gaining it back. But we are grateful to have the team here from the Ohio Department of Health as they make their way up. I just wanted to give a little context of why they're here and why it's important. I know we have seen the headlines of overdose death rates coming down, evolving drugs on the street and in the communities. And so we thought it'd be a good time to kick off the year as we embark on our next grant round, which we'll talk more about here in a minute, to really discuss, what's happening and really what is impacting the folks across the state of Ohio. What we know is that the overdose deaths are going down, and they're going to present information off of that But what we also know is that it's not time to take our foot off the gas when it comes to funding for behavioral health. And that's certainly our take, which is why we'll talk more about our grant round today. But to give a little context, not only to our regions, we thought it'd be helpful for you all to have it. We'll take this information and we're going to package it up for our 19 regions across the state and make sure they have the resources as well. But we wanted to kick the year off right with data. So with that being said, I would love to turn it over to Stephanie McCracken, which is the Suitors epidemiologist. She leads the data dissemination work around this, the Suitors data and the development of the Suitors dashboard. And with her is Rachel Blaney, who is also an epidemiologist supervisor with the Ohio Violent Death Reporting System, also known as Ohio VRDS, and the state unintentional drug reporting system known as Suitors. She oversees the staff and implementation of data activities. And I'm not using a mic, so apologies for that, for both programs. So please help me welcome both Stephanie and Rachel.
Good morning, everyone, and thank you for your attention today. Once again, my name is Stephanie McCracken. I'm the Suitors epidemiologist, and you might be wondering, what is Suitors? Well, it's Ohio State Unintentional Drug Overdose Reporting System, and that's what we're going to talk about today. Next slide, please. Okay, so the State Unintentional Reporting System, also known as Suitors, was developed by the CDC so that we can collect more in-depth information about our unintentional overdose deaths in the state. And how are we collecting this information? Well, we're actually collecting it from a multiple data sources that are required by the CDC for us to collect. So we collect information from death certificates, coroner and medical examiner reports, along with postmortem toxicology. In addition to that, the Ohio Department of Health also incorporates data from Medicaid claims data, the Ohio Automated Prescription Reporting System, and criminal justice data, just so we can get that extra contextual information about these unintentional overdose deaths across the state. Because the ultimate goal of this Suitors data system is to enhance our understanding of the circumstances surrounding these overdose deaths, along with identifying substances that cause overdose deaths and determine any emerging trends. Next slide, please. Okay, so this is a little bit technical, so I'll kind of breeze over this, but this is essentially how we're capturing our cases for unintentional overdose deaths in our data system. This was developed by the Center for Disease Control for states to follow, just to make sure that everybody is collecting these deaths uniformly. The way we're identifying these cases is through ICD-10 codes that are listed on the death certificate, along with a thorough review of the death certificate themselves, just to kind of look for any indication if the death was caused by an acute drug intoxication. And we also thoroughly go through coroner and medical examiner reports to ensure that what we're including in our data system is in fact an unintentional overdose according to CDC guidelines. So we just wanted to mention that up front, that's how we're capturing the cases. Next slide, please. So what information can Suitors provide? So in addition to the demographic information that we get from death certificate, we also get a vast multitude of information from all of the other data sources as well that we mentioned previously, including place of injury and death, injury events. So if the individual was incarcerated at the time, if they were in some sort of institutionalized setting, cause and manner of death, the circumstances preceding the death, and there's going to be examples of that in the next slide, along with that in-depth toxicology information that we do get from the postmortem toxicology reports that we collect from coroners. So we see the presence of substances precedent using this postmortem toxicology. We really delve into multiple substance involvement, along with detecting involvement of any emerging substances such as xylazine or medetomidine. Next slide, please. So once again, I kind of alluded to this in the last slide, but this is the kind of circumstantial information that Suitors collects. So we have mental health diagnoses and treatment, substance use history and treatment, personal and interpersonal circumstances, such as if the individual, had some sort of criminal history, or if they had a recent argument with a significant other, anything that was really recorded by the coroner or medical examiner, evidence of a prior non-fatal overdose, death scene evidence, such as what kind of drug paraphernalia was found on scene, response to the drug overdose. So was EMS available? Did they respond? Was there a bystander available that, you know, might have tried to resuscitate the decedent? And then we also have medical history and prescription information that's stored in this database as well. Next slide, please. So as you can see, we collect a lot of information, but so this is just a sample of what we get out of the suitors database. And just to give you a big picture, this is what we're seeing in terms of unintentional drug overdose trends here in the state of Ohio. So preliminary 2024 data shows that there's been a 32% decrease in the number of unintentional drug overdose deaths when compared to 2023. Unintentional drug overdose deaths have decreased 42% from an all-time high of what we saw in 2021 with 5,174 deaths when you compare to that of preliminary 2024 data with 3,012 deaths. Next slide, please. So the last slide emphasizes that unintentional drug overdose deaths in the state have declined. But of those unintentional drug overdose deaths that we're seeing currently, this is showing what are these, what substances are within these unintentional overdose deaths themselves. So as you can see, the vast majority of unintentional drug overdose deaths are, involve fentanyl. But what we're seeing is a decline in the percent of unintentional overdose deaths that have a fentanyl included as being involved in the drug overdose. And then on the other hand, we are seeing that there's a linear increase in the percent of unintentional drug overdose deaths that involve cocaine and amphetamines. And you can really see that more of that steep incline with cocaine. With, according to preliminary 2024 data, 44% of unintentional drug overdose deaths for that year had cocaine involved. So we're seeing like this change in the environment, and we're paying close attention to that as we're seeing less fentanyl involvement and more stimulant involvement. Next slide, please. So these are some drugs of interest, and this is what makes this data set so rich, is that we can look at specific substances, for instance. We chose these specifically because they're emerging in the drug environment, such as xylazine, and then we also have nitazenes and carfentanil due to their high potencies, and I'll go over those very briefly. So you can see with xylazine, xylazine is a veterinary sedative. It's never been approved for human use, but we have been finding that among decedents and unintentional overdose deaths. You can see there's a lot of numbers here, but I'm going to simplify this as best as possible. So you can see in 2020, 2% of unintentional drug overdose deaths have detected xylazine among postmortem toxicology among our overdose deaths. But then you go to preliminary data from 2024 and you see that has increased to 16%. So we can see that this is an emerging substance in our unintentional overdose deaths. We also have listed here nitazenes. Nitazenes is a synthetic opioid that can be many times more potent than fentanyl. It's a highly dangerous substance. And again, we're paying close attention to that. As you can see, we did see an uptick between 2022 and 2023. We're seeing it kind of go down for 2024, but we are keeping a close eye on this as well because it is such a dangerous substance. But we just wanted to give you an overview of that's how often we're finding that substance in our overdose deaths. Then we have carfentanil, which has a history in Ohio, an unfortunate one. In that 2017, almost a quarter of deaths in 2017 had carfentanil involved. And for context, carfentanil is a fentanyl analog that is up to 100 times more potent than fentanyl. It's a highly dangerous analog, and it's primarily used for large mammals. So if that gives you any indication on how dangerous this drug can be. Again, we're keeping a close eye on this. According to preliminary 2024 data, it's been found in about 1% of cases. We did see a slight uptick. So again, we're paying close attention to those numbers as well. Next slide, please. And okay, so we went over that big picture item, how many unintentional overdose deaths we're seeing in the state. We're seeing that there's a decline, and then what kind of substances are being found. Now we're moving on to the circumstantial piece. So this is the kind of information that suitors collects. So one of the characteristics that the CDC collects is the potential opportunity for intervention. So was there an opportunity for the decedent to maybe receive care, or was there a bystander present that might have been able to prevent the unintentional overdose or get the person to treatment? So the way that that's measured, and again, this is a measurement that was created by the CDC, is basically any one of the characteristics that's listed off to the right-hand side of this bar chart was present with that decedent. So one or more of those. So preliminary 2024 data found that there were 68% of decedents that had evidence of mental health diagnosis, 37% where a bystander was present when the fatal overdose occurred, 28% where a prior non-fatal overdose was recorded, according to the coroner medical examiner report. 14% where there was evidence that the decedent had received current treatment for substance use disorder, so they had received treatment within a month of their fatal overdose, along with a recent release from an institutional setting. So an institutional setting could be an overnight stay at a hospital, or it could be a recent release from jail. That was found in 9% of decedents. And finally, 7% had a fatal drug use witnessed by a bystander. Next slide, please. Another piece of information that we collect is where did these unintentional overdose deaths occur? And the big highlight that we found is that most unintentional overdose deaths do occur in the home. So again, according to 2024 data that we have preliminarily, 81% of those unintentional overdose deaths had occurred in a house or apartment, and 65% of those overdoses occurred in the decedent's house or apartment, whereas 16% occurred in someone else's house or apartment. So one of the big prevention pieces that we really try to focus on is most of these unintentional overdose deaths do occur in the home. In addition, we're also finding that most of them do not have evidence of a bystander being present. So really highlighting the importance of, if you're going to use, do not use alone. Next slide, please. So where can you find all of this information? You can find this information and much more going to our Ohio Suitors dashboard. So this is all available at on our website. So you just navigate to our website, which is the ODH Injury and Surveillance Data page, and you click on the data dashboards, and you can see new State Unintentional Drug Overdose Reporting System dashboard, and that's how you can get to all of that information. And we're going to really quickly breeze through what that dashboard looks like as well. Next slide, please. So this is the landing page. This is going to show overall trends. So this shows the yearly number of unintentional overdose deaths by substance and by month. So the data that is currently available is 2020 through 2023. We're currently working on getting on our 2024 data. But what's great is by default, all of this information will show statewide information. However, if you click on the left-hand side, anywhere on that map at the county level, you can select all of the information will be updated to include that county's information on the right-hand side. And we have useful tooltips throughout the dashboard to make this a little bit easier for everybody to read, because we do understand there's a lot of information that's listed on here. Next slide, please. This is just going to show statewide demographics, but this shows the number of unintentional overdose deaths along with the age-specific death rate per 100,000 for age, sex, and age group, sex, and race. So all of those numbers are presented there, and they're done by year at the statewide level. And off to the right-hand side, you can see the proportions and counts along with the age-adjusted rate per 100,000 population for unintentional drug overdose deaths by sex and race as well. And again, you can see on the bottom right-hand corner that tooltip. All of the graphics on the Suitors dashboard is going to have these tooltips to make this a little bit easier to read. Next slide, please. And we found that this would be very useful for counties looking for county-specific data. So the landing page is going to show the age-adjusted death rate of unintentional overdose deaths per 100,000 at the county level. It's color-coded, with the higher rates going to be in a darker color and the lighter rates going to be in the lighter color. And anything that was grayed out because there were less than 10 deaths, so we weren't able to have a reliable calculation of that. However, if you want to look at counts, you can see off to the left-hand side, you can view map by rate or count, and that'll update the map so that you can look at the counts of at the county level of the unintentional overdose deaths for the year that you selected. And then the right-hand side, those circle charts look familiar, but those can be updated at the county level depending on what county is selected on the left-hand side. And there's also a drop-down on the right-hand side showing county of residence, to where you can select the county that you would be interested in looking at the proportion of unintentional overdose deaths by sex or race. Next slide, please. And this is a little bit more involved, but again, by default, it will show the statewide percentages and counts, but you can update this so that you can look at a specific county of interest by selecting a county of residence at the drop down there. But what you're seeing is you can see the total number of unintentional overdose deaths by year at the very top. And the reason why we have that is because we do have a lot of bar charts here that show a lot of percentages. So we have the percentage of unintentional drug overdose deaths with select drugs that were listed as the cause of death by the coroner or medical examiner, along with the percent of unintentional drug overdose deaths where something was detected in postmortem toxicology. So you can see those percentages there. And then the bottom portion is really just highlighting that most of our unintentional drug overdose deaths are polysubstance, meaning that multiple substances are usually involved. So the users can not only select the year, but they can select the drug where it was listed as a cause of death. We have the default as illegally made fentanyl. But in this example here, you can see the percentage of deaths that have included other substances. So in this example here, it will show that illegally made fentanyl also involved cocaine. And I can't read that number from here, but I think it's at 68% of cases. But that's really what it's highlighting, is that most of our unintentional drug overdose deaths do involve multiple substances. Next slide, please. This is more of an informational slide. This describes what illegally made fentanyl is and how that is different from pharmaceutical fentanyl, and really defining what a fentanyl analog is. We did allude to a fentanyl analog, namely carfentanil, because of its potency. And the reason why we have this specific page is because we want to highlight that not only do we have fentanyl in the drug environment, but we also have fentanyl analogs, which can be more or less potent than fentanyl. So there's a lot of numbers here, but it shows the number of deaths caused by illegally made fentanyl and specific analogs that we have seen in the state since 2020, according to our suitors data set. And then the pie chart off to the right just shows the proportions of unintentional overdose deaths that involve fentanyl and fentanyl analogs, or the deaths that didn't involve either of those. Next slide, please. And then going back to that circumstance piece, this has been a piece that has been requested by our local partners. They really want to understand, what were the things that were going on with the decedents. And so what's great about this is not only can you see what's going on in the county, but you can compare that to the statewide unintentional drug overdose deaths. So again, you saw this on the bar graph earlier. You have the potential opportunities for intervention. So all of those different variables there, along with some additional circumstances that have been expressed to us as important to our local partners, such as what percentage of unintentional overdose decedents were homeless or had housing instability, along with if they had ever received substance use treatment. So these were just some characteristics that were expressed to us as being very important. Next slide. And then last and not least, we once again highlighting that most unintentional drug overdose deaths occur in the home. This is the top 5 locations where we're seeing unintentional drug overdose deaths at the statewide level. So you can see that the bar chart is color coded according to No bystander and bystander present. That just indicates that there was evidence of a bystander being present if you see the yellow bar there. And you can see that most unintentional drug overdose deaths do not have evidence of a bystander being present. So it really highlights that prevention piece of not using alone. And then we have that same information in tabular form, but includes all of the injury, place of injury that our SUITRS data set collects. And you can see the number and percent of unintentional overdose deaths where they occurred in each of those specific locations. Next slide, please. I think that's my done. I'm done talking about my stuff, and I'm going to pass it off to my colleague Rachel. All right, so I know we're kind of short on time, so I'll go through this quickly. In addition to our SUITRS data, we also have on our website, we have the 2023 Ohio Unintentional Drug Overdose Report. That's going to have a breakdown of demographic trends, drug involvement, as well as county level counts and rates. I know a lot of people are looking forward to our 2024 report. Unfortunately, our 2024 death data is still pending final review and has not been finalized yet. So once that's finalized, we will have a 2024 report available. If you do need 2024 data, we have the preliminary data summary for Ohio unintentional drug overdose deaths. That's not going to have the county level breakdowns, but it will have total counts and percentages. It'll also have breakdowns by drug involvement. So that may be helpful if you're looking for that more recent data. Next slide, please. And then finally, we have our emergency department visits for suspected drug overdose dashboard. So that's an existing dashboard that was recently refreshed in September 2025. It has new drug categories. It displays data from Ohio Syndromic Surveillance System, which is Epicenter. That data is going to have ED visits where a drug overdose was suspected. So that gives us more real-time data to see if there's some sort of large number of overdoses in a specific area. So it includes statewide and county level data from 2022 through 2024, and then it has total monthly visits for the first quarter of 2025. We hope to update this quarterly depending on staff capacity, but I think it's projected to be updated quarterly. So next slide. So that's all we have. If there are any questions, we're happy to answer them now, and you can also email this with questions. Thank you, Mr.
Thank you for the presentation. It was very informative. When you talked about the unintentional deaths, and 65% of them are at their home, how do you know they were unintentional? I mean, couldn't a percentage of those been suicide that we would never know because obviously talk to them, but and wouldn't that be even indicative of a larger problem, the mental health issue, not just a drug use?
Yeah, so we rely on our coroners and our law enforcement to, when we have that information, to make that determination. They do a pretty thorough investigation to determine intent. They look for things like a suicide note, for example. There is a large correlation between mental health conditions and people who use drugs. So I think it can be hard to say. We'll sometimes get some of those undetermined intent drug overdose deaths. And at that point, and we do register those in our system, we just don't report on them so much. So we do have unintentional drug overdose deaths that we capture. I don't know if Stephanie, do you have anything else you want to add to that? Yeah, the only thing I have to add to that, and that's why we're reporting on unintentional drug overdose deaths, and it's a good point that you presented, is that the prevention between, a suicidal overdose versus an unintentional overdose death are two completely different things. And that's why we split it up at the state. But just kind of piggybacking on what my colleague Rachel said, is that the coroner is going to determine the manner of the death, which is what you're referring to. And they do that through that very thorough investigative piece, just collecting as much information as possible and then determining what the intent of that overdose was from there. I have one more thing to add too. We also have our Ohio Violent Death Reporting System. It works very similarly. SUITRS is actually captured under VDRS.
and that will capture the intentional overdose deaths. So all of these overdose deaths are being investigated by, not investigated in the sense of law enforcement or coroners are investigating, but we do report on all overdose deaths and we collect all the reports and everything applicable to those. So they are being captured, and we do try our best to discern if there is any discrepancy. But yeah, we primarily rely on what the coroner determines in those cases.
I'd like to recognize Dr. Michael Rosier and then Tom Gregoire. Rosen.
We fund by county levels, if you will, by regions. That is, I think, whatever it is, the number of regions, is it 19 or I can't remember. But is there any way of having the data, say, the change from 2022 before we started funding to the current year or the last year you'll have, which is 2024 in a couple of weeks, I assume? Is there a way of looking at that, the delta or the change in percentage or people per 100,000, if you will, with an overdose death by those regions, and how could we get that data? Because it may be very instructive for us to look at the effectiveness of our funding by those regions.
So I think the best way you could probably do that is when we have the filters for county, you can select the counties that apply to your region, and that should give you the data that you need to, for each of the years. 2024, we're working on. I don't have a good estimate for that right now, but it's a big priority for us. We want to get this out as soon as we can because we know it's important data. But that would probably be my recommendation, is to select the counties that apply to your specific region that you want to know about. Let me know if that didn't answer the question.
I want to know about all of the regions, if you will, the regions as we fund them, to see the effectiveness of the funding that we have done.
Yeah. So for us, and I think this will be a good point to kind of think about our budget. So you all did approve that we could do some regional capacity through our budget right now. And so what we are trying to figure out as we speak, and hopefully in partnership with folks like the ODH team, is what available data can we break into a regional basis, and then what's the frequency that we can update it so that we can deliver some reports to the regions as they're making decisions, but also inform our work too of the impact that we're having. And we'll hear a little bit more about that impact here in a second when Gretchen comes and kind of shows our first evaluation report overview. So I think, Dr. Rosen, we're working on it, and we will be following up this year with more on that.
Thank you. And now Tom.
You feel better?
Oh,
I didn't sound too hot.
Every time I have to talk, my voice goes away.
I keep moving further away.
That's excellent. I really appreciate that. A couple of in the weeds questions. Given the one that just came up, and I know you said you're working on like 2024 data now. Is some data quicker than others? If we're going to use these data to, as Dr. Rosen suggested, look at impact, is there some data that shows up a little sooner so it can be more actionable?
Yeah, so the best data source I would say for that more real-time data would be that syndromic data, which was on the last slide, that dashboard. That's going to be our most real-time data. Mortality data or death data, it just, unfortunately, the nature of it just takes a while. Suitors does report on half years. We investigate deaths in a 6-month time frame. So we're right now finishing up the first half of 2025. One place where you can access some statewide data is CDC also has their own Suitors dashboard. Since this is a CDC program, you're not going to get the county level breakdown, unfortunately, but they're going to have the 2024 data that we are not able to report on just yet. So that would be a little more recent as well. Like I said, it just won't have the breakdown. But I would say for more real-time data, I would focus on the syndromic data to help us. That kind of gives us a hint at what we're going to see for deaths. It kind of gives us an idea of the trends.
Appreciate it. And I have one other question about the toxicology data. Early on, you identify a particular drug. We're super in the weeds here. This could be later if it's long. you identify a particular drug, and I was wondering, and then later you get to the point about polydrug use, but how do you unpack, how does the coroner unpack the drugs? Do those data include polydrugs? Many people that are dying from fentanyl don't think they're even using an opioid. So anything about that?
Yeah, so that's all going to come from postmortem toxicology reports that each coroner is supposed to be doing. It's pretty comprehensive at this point, but there's a chance that there's substances that, I think metatomidine is one that we don't know if is being captured uniformly. There is no like standard, unfortunately. I mean, there are some standards, but there's no requirements, would you say?
Yeah, the coroner primarily determines what kind of drugs that they test for, and and each laboratory is going to have a different panel for what is like the basic toxicology panel. So some might test like, most of them are going to test like your typical opioids like fentanyl, cocaine, heroin. But like some of those more specific drugs, they might not test for those right away. And the way that the coroner or medical examiner might determine, what drugs to test for is based on that scene investigation. So it's really a case by case thing. And then the coroner determines of the drugs that were present, which ones they believed were the cause of death. So they use their medical expertise to determine that as well. It is a very difficult thing to disentangle for us as well.
But this is extremely helpful. I mean, we said from the beginning, it's an addiction crisis and it's going to evolve, and that's what it's doing now. And that kind of data can help us think about our efforts statewide and in the regions about, prevention, recovery, and all of that. So well done. I appreciate that.
Thank you.
Jim, go ahead.
Yeah, just great presentation, by the way. A lot of really great information.
Thank you.
One of the first slides you showed was of the various drugs. There was a decrease in, I think, fentanyl use over the last 3 or 4 years, an uptick of cocaine usage. Do you have a sense of why that happens? Is it a societal thing? Is it greater access to cocaine now versus fentanyl? Is there a link there? Do we have an idea?
So there's a lot of different theories. I think we can't speak definitively on any of that. I think some theories are just the supply. I know there's been some shakeups with cartels, for example. Like I said, we can't speak definitively to that, but that could be a theory. I think there's also more awareness now of what there's testing strips, for example, that people are able to use, and there's more awareness of those. There's more awareness of the harms of fentanyl and its presence. So I think that's part of it as well. There's another report, the OSAM, Ohio Substance Abuse Monitoring Network. That's from our colleagues over at the Department of Behavioral Health. They put out a report where they essentially interview people who use drugs, clinicians, law enforcement, multiple groups where they get qualitative data about drug use, availability, prices, all kinds of information that we actually reference quite a bit to kind of get some insight into those trends.
Yeah.
It's a really great report that we look at a lot. I don't know if you have anything to add, Stephanie.
Just one thing to add. I was actually going to mention the OSAM report as well, and just to kind of add on to that, it's there. They also have regions, so it's a little bit more localized as well. So it's a resource that we definitely reference as well. So I highly recommend looking into that because it really gets down into what the drug environment is looking like in those specific regions.
Thank you.
And if I recall from reading the last OSAM report, there was some discussions about awareness of testing strips and awareness of fentanyl being in the supply and people not wanting to be exposed to that. So I think some transition over to other drugs like cocaine could be attributed to that.
Thank you. I'd like to thank Stephanie and Rachel and the Ohio Department of Health, but I'd like to have each of you think about this for one moment. We make our best decisions when we have great information. And you all know somebody who's in high school looking to do something with their life that benefits, society. I strongly recommend the degrees in public health at some of our state institutions. I know when I sit at the Kent State University graduations, it just excites me to see young people graduating with their degree in public health, because that's how we get this good information that we then make decisions from. So thank you so much. Like to next turn things over to again Alicia for our One Ohio Impact and Mission Moment. And we'll be hearing from the One Ohio team and Mighty crew about what went on in 2025 and what we're looking forward to doing in 2026.
I will keep this brief because my voice doesn't work at work today. So I will turn it over to Sarah. And Sarah, if you could just speak to the excitement of today as well as introduce Gretchen.
Yes. Today is an exciting day, but I won't steal my own thunder. I'm going to have Gretchen start first, which y'all may remember Gretchen, Dr. Gretchen Clark-Hammond, our evaluation partner, who's been working with all of our Cycle 1 grantees. So we're going to look back to see what's been going on with our Cycle 1 grantees from their first reporting period. And then we're going to talk about what is happening today and the work that we're all about to undertake together here this year. So Gretchen, I will turn it over to you and just tell me when to advance your slides.
Thanks, Sarah, and thank you everyone for having me. We are excited to give you a quick evaluation update as part of your mission moment. So go ahead, Sarah, next slide. So lots of exciting things were learned during the first reporting period which for grantees was opened the month of July. And it reflected for some of them 6 months of work, for others 3 months of work, because as you all remember, grants were starting at different times and they were in different stages of implementation. And we have just completed our first comprehensive report from that reporting cycle. We're going to be excited when that is released to share that with all of you. But this slide represents some of the high notes of what we saw already. Grantees are very, very productive. We were thrilled that all grantees turned in a report, again, with a new system and a new process. Everyone did a wonderful job. Looking at workforce, because we know that's such an issue, one of the highlights we saw was that through the funding from this foundation, grantees were able to create 103 new positions. And again, we've been dealing with workforce crisis for many years, and so that was very exciting. And they were able to retain another 93 individuals, and retention is just as much of an issue as recruitment. When we look at grants, clients served, grantees were very productive. They received your funding and they hit the ground running. And just in this first reporting period, they shared that they'd served over 17,000 clients. Again, just massive getting out there and serving people. Of that, we had over 11,000 adults and then about 5,600 youth. So a lot of work happening across the lifespan. Go ahead. We saw many, many people initiate treatment, over 10,000. Again, this is just that first reporting period. A lot of people enrolling into recovery housing, over 600 people making their way, moving in to recovery housing. Lots of local events that were raising awareness, providing education, building community, doing coalition work. So we had over 1,200 local events that were attended. And you all funded infrastructure projects too. And we had in that short amount of time, 16 infrastructure projects completed. And infrastructure could be something like putting a new roof on a building, renovating a building. I know you all had some amazing mission moments recently where you visited a renovated recovery home for women and children. You've seen other things. And so people are already completing those projects. And again, doing a lot of work very quickly with foundation dollars. Go ahead, Sarah. And so we asked grantees to share with us how your dollars were directly impacting them from their perspective of organizational change. And to me, this is the mission moment in so many ways, because this is their expression of how your dollars are helping them. So one of the ones I'll read to us is, funding enabled the expansion of evidence-based treatment and recovery initiatives, including expanded group therapy offerings and peer support services. And that grant was, that quote was very reflective of what we were hearing across many of the grantees that you supported in that space of treatment and recovery. And many of our counties, as you know, services have been pretty limited. And so this allowed them to launch and go and start providing things and reaching people. I'll let you read some of the other quotes yourself, just for time's sake, but you're going to see this theme of your dollars really making a difference, because they could hire people, they could get the boots on the ground, they could get out there, they could serve folks, they could add things that they didn't have, and they felt like they were reaching people as intended. Go ahead, Sarah. And again, like this one, we've been able to provide enhanced stabilization supports to those impacted by mental health and substance use concerns, especially those who are involved in criminal justice. And we'll be able to hire an additional mental health case manager who will be able to focus on this population. Again, these are the big themes and some quotes that really stood out to us, but grantees are seeing a huge difference in their capacity as organizations to do the work. So your dollars really are making such a significant difference to them as organizations. Go ahead. And that I made it quick on purpose. One of the slides that's not in here, I just wanted to remind everybody, grantees are currently in their second reporting cycle. It opened on January 5th. It will close on February 5th. So they're reporting on the 6 months of work prior to. We anticipate getting additional insight into their progress because everyone will have had those same 6 months of implementation. They're also gearing up to potentially apply. So grantees are very busy right now as they complete their report for all of us and potentially are applying. We will be then preparing to analyze their data. It takes us a few weeks to make sure everything is clean and in good working order. We sometimes have to follow up with grantees, ask additional questions, etc. And then we jump right into the analysis of that work and we'll begin to produce our next report. Our current report is under review with the staff. It's long and comprehensive. We've learned a lot of wonderful things from grantees. So I'll pause there. I saw a hand go up, but I will just wait for the order. I don't know if I call on you, Greta, or if our chair calls on you. I don't know the rules.
Greta, did you?
Yes, Dr. Clark Campbell, thank you so much for the report. And I know you went much deeper into grants committee and with the data, and we appreciate it so much. Of the proportion of treatment funded grants, is there a sense of how much of those are really crisis oriented services? So I know one of the things that we're concerned about at the local level are that services are available when people need them. And that could be at very inconvenient, not 8 to 5 time frames. So do you have a sense of how many were crisis related?
We don't ask that particular question. Our questions, and for those of you who have not looked at the data dictionaries on the grantee resource page, everything we've developed as an evaluation team is there. And that's purposeful so that grantees have access. There are 8 different data dictionaries depending upon your core activity area. And in direct services, we ask a lot of questions about the services that people provide, the people that they're serving, but we don't ask specifically, is this a crisis service? I would guess, though, from working in the field for a very long time, that it's probably a blend. Most providers, even if they're not the quote designated crisis provider, are trying to serve people the moment they call. We've known that forever. This is my 27th year in the field. We've known forever when someone wants help, help them, because that's when you strike when the iron is hot. And so I would say, regardless of like ASAM level of care that they're providing, they're probably trying to get someone in as quickly as possible. In Ohio, over the last years, five years, we've really started designating and pulling crisis services out. And so I think that will be something that we continue to look at. To Alicia's comment earlier, I think more data will be coming forth out of that crisis world and the centers that the state is setting up and supporting to help us know what that looks like as people enter the designated crisis centers and then make their way through our continuum of care. So I guess I would say more to come as we continue to look at data.
Go ahead, Keith.
Question. Do you, from what you've looked at, do you feel as though those folks who put a grant in that would be sustainable over time had a true sustainability plan, or did they just state they did and were kind of hoping that they get funded in the next round?
It's a good question, Keith, and I love talking about sustainability, so thank you for asking it. At the time of their application, I don't know how good their sustainability plan was, right? Because I didn't really know the grantees. But now that we've read their report, one of the things we decided to do as an evaluation team was begin to plant the seeds of sustainability. We did an Impact Academy with Sarah back in April, where we talked about the 8 domains of program sustainability. And if you've never looked at that tool, I encourage you to do so. It comes out of the College of Social Work at UWash in St. Louis. And it breaks down that there are 8 things. Finance is just one. 8 domains that really build towards program sustainability. And so what we did in the evaluation was we put those 8 domains in our questions. And we asked grantees and we defined them. Which of these 3 are you recognizing are being impacted by the One Ohio funds right now. And then we had that Impact Academy as well. And we're trying to help educate grantees that sustainability is multifaceted. And you have to start looking at many things. And the domains are things like partnerships, communications, evaluation, organizational capacity, flexibility, so that they can start to see that one grant will not sustain you, right? And how do I start to build and leverage funds or recognize what other people are doing? So it'll be interesting because we asked them that same question in the reporting period that's open right now to see what has shifted. But when we went out to the 18 of the 19 regions, we actually did specific reports to them with their data. So October and November, we were on a road show with staff going around, and we were able to show regionally what people were seeing with sustainability. And that ended up being very interesting as we were in each region, seeing how that was showing up differently too. But yeah, we hope to strengthen that for them. I think it's a hard question to answer if you've never been really coached on what sustainability planning looks like.
Well, I think the other challenge is if there's not other funding streams in those
Right.
areas, then it makes it difficult to do that. So
Well, yeah, totally agree. Oh, thank you. So some of our findings, again, from our report, we saw people, when we asked them what kind of organizational change was happening because of this funding specifically, we saw workforce capacity and expansion. They, of course, are expanding. They're being more innovative. You allowed them to bring something in they didn't have before. It was interesting, too. Region to region, partnerships would show up and people would say, we are partnering with entities that we couldn't partner with before. Sometimes funding brings people together. And so they were building bridges and partnerships. They were improving their infrastructure, their systems, and some of their sustainability. And they felt like, too, that they were having a greater holistic impact, meaning they could really wrap their arms around a person and all of their needs. When they ranked their domains across everyone, the top domain was organizational capacity. And the color variation lets you know dark blue was their number one. The medium colored blue was ranked second and the lightest blue was ranked third. And so the way to read the chart is the totality is all three colors combined. So org capacity right at the top, followed by partnerships and then funding stability. But what I take away from this is that it's touching all of the domains, because an organization can be in a very different place, you know, from its neighbor, right? Where maybe we're great at partnering, but your dollars really helped us look at our data for the first time. So for us, you enhanced our evaluation. And it changes, like I said, organization to organization. So we're glad that we asked that and broke it out this way, because I do think you all have such a commitment to like supporting grantees, and you offer these wonderful impact academies. And I think things like this to educate people on what does it look like to actually do sustainability planning is so helpful, because that's not available everywhere. And it's such a needed piece of education. Thank you so much.
Well, thank you so much for those exciting updates. We appreciate it and appreciate the hard work. Oh, you're going to do regional. Okay. Now we're going to move to the regional grant cycle 2.
Thank you. All right. Big day. We're going to talk about the regional grant cycle 2. So we're going to start at a high level with the process. There are 6 steps in our review process for our grant cycle. Many of these should seem familiar to what we did last time, but there are some tweaks. So I will talk through each one of these so that we all feel really comfortable and confident in what is about to take place this year as we launch another grant round. So first up, super exciting day for the foundation. Our grant portal opened this morning. And Laura, our grants manager, confirmed we already have folks that have logged in, created an account, and are working on a funding inquiry. I believe at like 8:30 this morning, it was 39 people. I'm sure it has only increased since then. So kudos to Laura and Asede on our grants team for all the work that they have been doing behind the scenes to get our grant portal ready, and to the grant oversight committee for helping us get to this place to launch this new grant round. So today's the big day. You can go on our website. This is where you will click to access the grant portal. Just as a quick reminder, folks have until February 11th at 5 p.m. Eastern Time to get in their funding inquiry submitted. Please submit early, so we want to make sure you don't run into any tech challenges. So Folks have from today until 5 p.m. on February 11th to submit. So our website has already been updated, so folks can access the grant portal right here on the Grant Cycle homepage and log in and make their account. This is a screenshot of what the grant portal looks like once you have created your account and started your funding inquiry. This is that landing page. So I just wanted to give some visibility to the board and any members of the public that are on here of what it looks like when you log in. I made a test submission. It was super easy to use, and we'll be talking more in a few slides about training we're doing to help applicants be successful here. And for our board and our regions, we've been sharing some updates with y'all. So the picture on the left is a screen grab of an email that all of the foundation board members received on Monday afternoon from Alicia. Check that email out if you haven't seen it yet, because it's got all of the key dates that we want y'all to know about, links to some training, some compliance reminders. So you've got an email Monday with key details about this grant round, and then a very similar version of that will be going out to all of our regional board volunteers later today from Mackenzie, so that they have all of the same information. What we've added into that region email is the option to sign up for new regional board volunteer orientation, because we have a lot of new folks. This is their first time going through this process with us, and we want to orient them to the One Ohio Recovery Foundation, as well as signups for their regional grant reviewer training, because they'll need to learn a new system and some of the nuances of this new grant round. So a lot of great things happening and lots of communication going out. So please watch for those. If you didn't get them, please let us know so we can re-forward to you. And as a reminder, here is the breakdown of available funding by region. This is included in the RFP and it's on our website, so folks can look up how much is available for each region. And this does include any carryover from Cycle 1 was included in this. So I'm going to quickly touch on some highlights from the RFP. If you really want to nerd out and get in the weeds with us, we have recordings on our website from a 90-minute training we did on the RFP. If you want to watch that, or I'm sure myself and anyone else on the staff team would talk you through it in great detail, because we're really proud of the document. But here are a couple things that are new this year that we wanted everyone to be aware of. Applicants are limited to submitting 2 funding requests per region. So that is new, 2 per region. All projects will be funded for 24 months. So you may remember that last round, applicants picked whether they wanted 12, 24, or 36 months. This time they'll all be 24 months. And funded projects will all begin on one of 4 predetermined start dates that are detailed in the RFP, and these align with our data and reporting and evaluation process. I know we heard from Gretchen that, when we have varying start dates, it then makes comparing and evaluating a challenge. So we wanted to get everyone aligned. So we think that these are improvements to our process based on reflecting on what happened last time and what we're seeing. So these are some general updates to the RFP this time. And for our regions, they had the option to establish a maximum request amount. We had one region take advantage of that, and that is reflected in the RFP. And also regions had the option to communicate more detailed funding priorities in the RFP this time. And you can see some examples here. So there's really kind of 3 trends we saw. There were regions that were still open to accepting all funding inquiries that meet RFP requirements. We had some regions that were open to receiving all funding inquiries, but still wanted to communicate some priority needs. And then kind of the last bucket we saw are regions that wanted to limit funding inquiry submissions they received based on their very specific funding priorities. So all that's detailed in the RFP, and kudos to our regions who spent a lot of time in kind of the back half of 2024 using data and information, using the region planning guide to set these funding priorities. They looked at data, they looked at community assessment plans to inform where they really wanted to focus these dollars. So this was new this year that we're really excited about. And this is all detailed in the RFP. So once applicants submit their funding inquiry, the funding inquiries will be sent to the regions. So each region formed a regional grant review committee. That looks different for each region. Some of them, it's everyone on the region board. For some of them, it's a subset. But the regional grant reviewers review. They present their funding recommendations to the full regional board, then votes, deliberates, and then sends their recommendations on to the foundation. From there, our expert panel reviews the recommended funding inquiries to ensure alignment with the abatement strategies and that they are supported by evidence. We're really grateful for our expert panel for continuing on with us this round and helping us review funding inquiries. So new this year, so the funding inquiries that the regions recommend and send forward, after they've been reviewed by the regions, reviewed by the expert panel, we will then invite those recommended organizations to submit a technical application. This doesn't guarantee their funding, but this is our chance to get some additional information from the organization before we start to, finalize anything. So staff will review what comes in to ensure alignment with the region funding priorities, RFP requirements. We'll get updated budgets if they got a partial award. So it's really technical details to then manage and execute the grant agreement. But this is new. So only those that are moving forward will be invited to submit this. And again, it doesn't guarantee funding. So from there, with the region's feedback, the expert panel's feedback, and then any staff feedback, we will put forward the funding inquiries before the Grant Oversight Committee, who will review and then make final recommendations for funding to the full board of directors, which is all of you. So y'all make final funding awards by vote. Organizations that are not approved will receive notifications. So if you were invited to submit a technical application but didn't move forward, you'll be notified, and all award announcements are made after the grant agreement is fully executed. So that is the process we will be following this year. And another improvement we made this time is that regions will move through each of these steps together. Like all region, threes will move through each step together. So it's rolling by region as opposed to rolling by individual application. So everyone will know at the same time kind of when each region's awards have been announced and are made. So that is something new, but we still expect that we'll have lots of, funding award Wednesdays because we do have 19 regions. So a lot of opportunities to make award announcements. So this was the process. This is on our website. Moving quickly, for any applicants that are on the call today, please, if you have questions, please start by reviewing our website, the RFP, and our FAQs on the website. We have a lot of great information on there to answer any questions you may have. If you have read through all of that and you've watched our training videos and you still have a question, please email apply@oneohiofoundation.com. All grant communication needs to be sent to the foundation staff. So this will allow us to maintain the integrity and fairness of a very competitive grant cycle. But please note that due to the volume of applicants and inquiries that we receive, we cannot provide direct guidance on project-specific questions because we want to make sure everyone's getting access to the same information. So start by reviewing what's on our website. If you still have a question, email to us and we'll do our best to answer, kind of given some of the parameters that we have to ensure a fair process. And then lastly, around communication, please, if y'all are approached by folks, please direct them to foundation staff. We really want to make sure that folks are getting accurate and timely information, and that we also are aware of any kind of frequently asked questions that are happening. There may be something that folks are all being asked that we then should just clarify on the website. So please direct everyone to foundation staff, whether you're a foundation board member, regional board volunteer. send them to the website and then send them to staff. So we can make sure everyone's getting timely, accurate information, and we're keeping it fair for everyone. And there's a ton on the website for folks to dig into that we're really proud of. And most recently, that RFP training that I mentioned, we did one in December, and we had 524 people attend, 524 unique viewers. I verified that, with over 750 people registered. And then we did another one in January where we had 499 unique viewers. So a lot of folks have tuned in to our trainings to learn more about this grant round. And this was recorded, posted on the website for folks to refer back to. We have some upcoming webinars and impact academies as well to further pour into our applicants. On January 21st at 10 a.m., we will be having a funding inquiry webinar. So on this, Laura from our grants team will be leading us through how to log into the grant portal, create an account, how to submit your funding inquiry, and walking us through all of the questions. And then on January 27th at 10:30, we will have an impact academy on the evidence guide for applicants. This was something new we did this year because we really wanted to strengthen our applicants in their submissions for those evidence related questions. So we're very excited about these. I've shown this 3 times already, but as you can see, there's a lot of steps in our grant review process, and there's a lot of people involved in our grant review process. Our latest numbers, it's about 342 people. We'll keep this updated to see kind of how many are truly involved in this. But it's a lot of people in our network, and then a lot of people across the state that are interested in the work that we're doing. And because of that, we need to all be mindful of conflicts of interest, whether they're actual, potential, or perceived. So we will be coming back to do some training, as well as having all of us fill out a conflict of interest form that is very specific to this grant round. All of our regional board volunteers have been completing this, so since they start their review process first. So watch for an email with additional details about conflicts of interest. Foundation board staff, our vendors, we all will be filling these out as well. So that's, I'll move it back to a funner slide. I talked fast, but I think I left some time for questions. Anyone has any?
Just a comment. Good morning, everyone. This is Dawn Tyler Lee. I had an opportunity to tune into the webinar last week just for my own information gaining. And as we all know, grant processes and applications can be very complex. And I just wanted to take a moment to celebrate Laura and Sarah for the way they talk about this work, the way they talk about the grant process, and make it very user-friendly and are very accessible to our grantees and potential grantees. So just a continued thanks to the staff for making something that is relatively complex, I think, clear and understandable and accessible for our potential grantees around the state. So thank you for that.
Thank you, Dawn.
Any other questions or comments? When hearing that again, I really appreciate that update and best wishes again to you, Sarah. I think it's easy to not understand all the complex work being done in the background, even to put one slide up on that presentation. So thank you. I'm looking forward to round 2 and helping people. So with that being said, I'd like to move on to the Audit and Finance Committee report, and I'll turn over to the Chairman, Evan Claymire, to report from the Audit and Finance Committee.
Thank you, Mr. Chair. I am going to jump into the October and November financial reports. The committee did meet in early December, and we reviewed the October financial report, voted on it, and recommended to the full board for approval. We did not review the November financial report, which we will do that today at the board meeting. If we could go to the next slide. One more. There, if we can go one more, sorry. There we go. Total operational spending in October was consistent with prior months and within budget. Budget savings are related to not having an investment officer as expected, and we've discussed, as well as not having some of the staff in place as anticipated. These programs are expected to start in 2026 and are included in the 26 budget. So if we can go one more. And you can see there, we have a partial payment in October of $706,000 from Walmart. Let's go one more. In October, there was a total of 2.1 million in grant payments that were made in accordance with the planned schedule. We still have approximately 25.4 million still to be paid out for the first grant cycle over the next 2 to 3 years. Are there any comments or questions on the October financial report?
So then we need a motion to approve the October financial report as recommended by Evan,
So moved.
by Greta, the motion,
Second.
by Daphne, the second. Any discussion on the motion? All in favor, say aye.
Aye.
Opposed, motion carries.
All right, thank you. Let's go forward one slide. Next, we have the November financial report. It's very similar to October. Expenses for November are on track with budget. The remaining budget balances suggest that 2025 operations will all be within budget allotments. Total expenses are consistent with prior months' reporting. No settlement dollars were received in November. Approximately $1 million was paid out to regions in November for grant cycle 1 payments. Let's go forward one slide. One more. And total grant payments due to the regions are approximately 24.4 million. Payments are on schedule with grantee agreements. Are there any questions on the November financial report?
Hearing none, I'll look for a motion to approve the November, and I'll go to Jim to make the motion since he was close on the last one. Is there a second? Is there a second? And Jeanette seconds the motion for approval. Any discussion on the motion? All in favor, say aye.
Aye.
Opposed, and the motion carries.
I'd like to make 2 other announcements for the work of the committee. The committee in December approved the vendor contracts for 2026 that are over the $30,000 threshold as outlined in our financial policy. We also set the 2026 Audit and Finance Committee calendar. Those dates have been sent to the committee and they are also on the website.
Thank you. Thank you very much. So the next item we have for the agenda is to go into executive session for legal contract matters. And then we will have a motion and then a second for that. Motion is made by Larry, second by Tom Gregoire, and we use a roll call for that.
I will give everybody online a second to unmute themselves. But Director Baker,
Yes.
Director Claymire,
Yes.
Director Terry Johnson, Director Rob Blaisdell,
Yes.
Director Tyler Lee, Director Driehaus,
Yes, for Tyler Lee, I'm sorry.
Director Driehaus, Director Mattia, Director Silac, Director
Yes.
Greta Johnson,
Yes.
Director Hohottle,
Yes.
Director Piccirilli,
Yes.
Director Dodge,
Yes.
Director Powell, Director Wierzbicki,
Yes.
Director Mason,
Yes.
Director St. John,
Yes.
Director Mayer,
Yes.
Director Amen,
Yes.
Director Bruce,
Yes.
Director Hondrew, Director Whiston,
Yes.
Director Ayers,
Yes.
Director Gregoire,
Yes.
Director Kidd,
Yes.
Director Lee, Director White,
Yes.
Director Radcliffe,
Yes.
Director Roizen.
Yes.
Thank you. We will now go into executive session, convene the One Ohio January meeting, and the first item on the agenda is the Personnel Committee. And I'll turn it over to Julie, who can do an update.
All right, very quickly. At the last Personnel Committee, we made a few key decisions. And we decided on a 401k match program through Slavic Retirement for the staff. Starting in 2026, staff will have the opportunity to have their 401k contributions matched. The first 3% will be matched at 100%, and then the following 4 and 5% will be matched at 50%. We will also be providing a 3% discretionary match for any staff who participated in the 401k program in 25. We improved the benefits program for staff. It includes medical, dental, and vision. And we worked through the Ohio Chamber to get a very competitive rate. So the staff will continue to get their medical benefits from Anthem. We approved a paternal leave policy for staff. This will be an added policy to the personnel handbook. And all of these actions were approved within the 25 and 26 budget. So no budget actions are necessary.
Any questions? Any questions for Julie? I don't see any online or in the room. Thank you very much, Julie.
Certainly.
I'll now turn it over to the Investment Committee report from Jim White.
Thank you, Chairman. Not a huge update other than, I think the last update, we are fully operational with kind of the treasury management, with our cash at PNC. I just got an update from our representative there a couple of days ago about just kind of the year-end portfolio and how it stands. So things are going extremely well there. The big highlight is that we are finally narrowing the funnel down for investment advisors. We started out with, I think, 16 or 19 RFPs that we sent out. We narrowed that down to a list of 10. We narrowed that list down to a list of 4. And now we are down to 2 contenders, potential partners, both of which I think would do an outstanding job. We are actually meeting today with both potential partners actually here in Columbus to do kind of final interviews with the staff. So I appreciate everyone's effort on the committee staff for this process. It's been a long process, but probably started in late September, early October, but we are, as they say in football terms, in the red zone. And we're about ready to punch the ball in here, hopefully. So the next, really the next, couple of days, hopefully. So that's my report. Thank you.
Any questions for Jim? Thank you. I'll move on to the Grant Oversight Committee with Tom Gregoire.
However, yes, good morning, everybody. Checking the time. Oh, here we are. I don't have a lot to say either. We've heard a comprehensive report on earlier from Sarah. I do want to second Don's comments that thank the staff. It's rather stunning what they pulled out, and the thing I think I appreciate the most is how well we've applied to last time. It's sometimes when it's busy and you're sped up, you don't take the time to slow down and learn, and we did. And there's a phrase, slowing down to speed up, and I think that will be really applicable to this process. Seeing the data from Gretchen was cool. Just those numbers. How many people have engaged? Later we'll learn more about impact, but how many people were hired? How many people were engaged? Our potential impact is really broad. And just the things also I would quickly add, all the ways we're helping areas develop. There were regions that have been doing this work and thinking about it for a long time, and there are regions that just met each other as they came together. And these, I'm going to lose the name. What do we call all these development training activities? Impact Academies. What a perfect name for it. Learning for impact. So I'm just proud of the group and appreciate the hard work and the hard work of the committee as well too. It's an exceptional grant committee. And that is my report, unless you have questions.
Any questions for Tom? And I don't see any on the monitor here or in the room. So Tom, again, thank you for all your work you're doing on the Grant Oversight Committee. Next item is news, business, and announcements. Is there anything from members of the board? New business and announcements. Well, hearing none, I'll remind everybody that our next meeting is March 11th, 2026. Really appreciate everybody's efforts. Is there a motion to adjourn? By Tom Winston, second, Greta. Motions to adjourn do not have debate. All in favor, say aye. Opposed, and the motion carries.